We're going to watch the benefits video for Anthem Blue Cross. This is a video that's being taken on 10th December 2015. Do you currently get your insurance through your employer? No, I purchase it individually. Is that insurance with Anthem? Yep, I'm a member. Was your health plan in place before March 23rd, 2010? Now that's the date that the rules of the Obamacare or ACA went into effect. It was in place before the 23rd of March of 2010. Which plan do you have? I have a PPO plan.
Hi, I'm Ben. I understand you want to learn how your health insurance plan works, how it can help cover your medical costs?
Yes, please.
Great. So tell me, does your health insurance plan just cover yourself or other members of your family as well?
My family.
Good to know. Now pay attention, because I'm about to tell you a story about a guy who also has a PPO plan for his family. His name is Larry.
Hey bro, just started my shift. What's up?
Hey sis, just want to let you know I'm going in for my annual physical.
A physical? With the doctor?
Yep,
And not because you're sick?
not even sick. Whole new year, whole new Larry, thanks to your influence.
Yeah, Ellen, who is a nurse, had only been telling Larry to do this for what, 15 years? Anyway, the real cost of the yearly exams for Larry, his wife, and 2 kids was over $800. But with Larry's family PPO plan, other than the premium, these particular services cost them nothing.
On the last video,
So,
Larry
yeah,
paid
for
$25
preventative
each.
care, Larry's costs are pretty affordable because Larry, like you, was grandfathered into his plan. Are you familiar with the concept of grandfathering?
Yes, but remind me.
Quick brush up? Not a problem. Let's pretend that starting now your mobile phone company will be charging $6 per text message and that your current contract, with much lower rates, is going to be grandfathered. Grandfathering means that your current contract is allowed to continue without that particular change. As far as your healthcare plan, this means it's not subject to every single mandate that healthcare reform requires. Keep in mind, certain kinds of changes to your plan can also affect this grandfathering status. If you're not sure about your status, go to anthem.com for more information. However, there are advantages to each type of plan. So, Larry has that going for him. And you do too. And speaking of affordable, let's say you get a bad case of the nauseous, icky achies. Visits to your regular doctor will only cost you a small fee, maybe $20 or $30. This fee is known as a copay. Sometimes only the first couple visits are paid with a copay. After that, they'll count against your deductible. Do you know what a deductible is?
Sort of. Can you
I'd be happy
explain?
to. In many medical plans, there's a certain amount of money you pay out of your own pocket before your insurance plan starts to cover part of your costs. That's your deductible. Getting back to doctor's visits. Like Larry, it's important that you go to doctors and medical facilities in the PPO network, because going out of network will cost you more money. Now, I did mention Larry had a premium to pay. Do you know what a premium is?
Yes, I do.
Good. So premiums can vary quite a bit. And actually, I wanted to mention, all of Larry's numbers are just examples. Medical costs and coverage may be different for you, but what will be similar is how your overall PPO plan works.
Hey bro, what's up?
Ellen, look at this.
What's that?
My cholesterol numbers.
Ooh.
I never should have gone.
No, Larry, going to the doctor does not give you high cholesterol. However, not going means you don't know you have it, which would be bad.
My doc, she wants me to exercise every day of the week. When am I supposed to watch television?
You could jog to work.
Why don't I smell like a stale bologna sandwich all day? Although, I could learn how to rollerblade like I've always wanted to.
I don't know, Larry. You and rollerblades? Are you sure?
Yeah, not the best choice of exercise equipment for Larry. In the meantime, Larry's doc wrote him a prescription. Larry was able to mail order a 90-day supply of the generic drug for a flat fee, or a copay, of $60. The copay for the brand version would have been almost double. You might owe coinsurance instead, depending upon your plan and the cost of the medication. So, on Larry's particular PPO plan, his deductible for the whole family is $2,000, but that only involves medical services, not prescriptions. In some cases, plans may have a separate prescription drug deductible, which may apply first. For Larry's prescriptions, though, he just pays his copays right from the beginning. And by the time spring was in bloom, it was time for Larry to get another 90-day prescription. And, again, Larry only has to pay his copay. You tracking with me here?
Sure.
Wonderful.
Hey, Larry, what's up?
Ellen,
What?
I'm in the emergency room.
What? Wait, hold on. Okay, now what?
I'm in the emergency room. I got an allergic reaction and my tongue swelled up.
Oh my gosh, how did that happen?
I was just eating a chocolate-covered apple and suddenly my tongue blew off.
Okay, it must have been the nuts.
I didn't have much.
Oh, poor Larry. It was the chocolate. That, my friend, is an expensive taffy apple. Although the member discount does help. Alright, so let's take a look here. To cover the costs of that ER visit, Larry will have to pay off his individual deductible first. Then, he's got an $80 copay for the ER visit, but after he pays that, his insurance kicks in. For the costs left over, Larry only had to pay 20%. That 20%, Larry's percentage share of the costs, that is known as coinsurance. On Larry's plan, for almost every medical service, Larry's coinsurance is 20%. Although, keep in mind, your exact coinsurance percentages may be different. Still with me?
Yep, keep going.
Great. Now, there are a couple exceptions to point out. First, you'll probably also have a small copay for visits to specialists, like a heart doctor or a foot doctor, and for things like x-rays as well. Second, these rates only apply to doctors and hospitals that are in the PPO network. That is, if you go to medical providers who are not in network, your costs will be higher. Were you able to follow all that?
Yep, got it.
Excellent. Unfortunately, by fall, Larry's family is not fantastic.
Hey,
Oh, when does little Lucy get her cast off?
not for another month. I knew I shouldn't have built her treehouse up so high.
Or, taught her that kids can't fly.
Yeah, I guess.
Oh, dude. Your eye.
I think it's pink eye.
Yeah, it's pink eye. That is super contagious, okay? Stay away from Linda and the kids.
Oops, too late. But at least Larry took his family to an urgent care center. When you don't have a real emergency, urgent care centers are a smart alternative and cost a lot less than an ER. And that urgent care center was in network, which means Larry's medical plan had negotiated a discounted rate for members. Okay, so we've got the costs from the urgent care visit, not to mention the costs from the unsuccessful experiment with human flight, conducted by Larry's daughter from the treehouse. Since Larry already paid off his deductible, he only had to pay his coinsurance and a copay or two on these new expenses. His plan paid the rest. You're still with me, right?
Yep, I sure am.
Beautiful.
Hi. Happy
Hi.
Thanksgiving.
Happy Thanksgiving.
Did you get the turkey Mom sent?
Yeah, the nurses were nice enough to put it in a blender with some gravy so it could fit in my tube here.
Oh, turkey shake. That sounds great. Hey, I bet you're their first patient who ever rollerbladed through a construction site.
Yes, I am.
And if you think he looks bad, check out the medical bill. Yeah, it all sort of adds up. And the member discount? Phew. Although there's still a lot left. Fortunately, Larry only has to pay 20% of that, his coinsurance. And maybe a copay for the hospital or outpatient clinic. Oh, wait a second, Larry doesn't even have to pay that much. For the entire year, Larry is responsible for covering $5,000 of his bills, also called his maximum out-of-pocket costs. This includes his deductible, and with these giant bills, he definitely hit this threshold. The costs left over will now be covered at 100%. If Larry has any other medical costs for the year, he'll pay nothing, except maybe a copay on any qualified prescriptions. Everything else is covered, as long as he goes to providers who are in-network. And that, in a nutshell, was Larry's year.
Quick summary of how a PPO plan works? Sure.
Great,
Keep-
okay.
pay
First
attention to
order
this
of
one.
business, preventive care. Covered at 100% by your health insurance. If you've got any prescription costs, you'll just pay a small fee for those. Next, you've got your deductible, which you'll have to cover out of your own pocket first. Once your deductible is paid off, your health insurance starts picking up most of the bill, as long as you stay in network. You'll just owe a small co-insurance percentage, and possibly a copay or two. And if, like poor Larry, you reach your maximum out of pocket, you might still have a copay for your prescriptions, but any qualified in-network medical care you receive will be covered at 100% for the remainder of the year. Does that all make sense?
One more time.
Will do. First order of business, preventive care. Covered at 100% by your health insurance. If you've got any prescription costs, you'll just pay a small fee for those. Next, you've got your deductible, which you'll have to cover out of your own pocket first. Once your deductible is paid off, your health insurance starts picking up most of the bill, as long as you stay in network. You'll just owe a small co-insurance percentage, and possibly a copay or two. And if, like poor Larry, you reach your maximum out of pocket, you might still have a copay for your prescriptions, but any qualified in-network medical care you receive will be covered at 100% for the remainder of the year. Now on January 1st, Larry's deductible and maximum out-of-pocket reset. And Larry, taking Ellen's advice for his New Year's resolution, got rid of his rollerblades and bought himself a very, very safe, recumbent exercise bike with airbags. Before we part ways, would you answer a few quick feedback questions about this experience?
No, thank you.
No problem. Well, listen, thanks again for speaking with me. Now remember, Larry's case was just an example. Your policy may be a little different, but if you have any questions, consult your plan documents. But if you're still uncertain, don't hesitate to call us. You'll be able to find our customer service number on your member card. And keep this in mind, just like Ellen, you too can have a major impact on the health of your friends and family. I'm not just talking about giving advice. When you take care of yourself, you influence those you love to do the same. That's a fact. Hey, if you've got a couple extra minutes and are interested in seeing how much you've learned here, we've got a little trivia game. Want to play?
No, thank you.
No problem. If you want, I can take you to our member website where you can learn more. You'll have to log in there, even if you already logged in before talking to me. Sound good?
Nah, I'll pass.
No problem. You can simply close this window and browse around at your leisure. See you later.